I'm Eileen Doherty, and I am the director of the Colorado Gerontological Society. And for today's presentation on how to use the Medicare.gov prescription drug plan finder, we're going to solely focus on the plan finder. And I'm just going to walk you through some scenarios so that you can kind of become familiar with what's on the Medicare.gov site and how you can use that for your own programming. So I've gone to Medicare.gov, as you can see up here in the URL, and it says it's open enrollment now through December the 7th. If you have used this plan or this website before and enrolled either with a Medicare Advantage or a prescription drug plan, you can actually use this tab and go into your own personal account. For today's purposes, we're just going to go into the Find Health and Drug Plans, and we are going to specifically look at prescription drugs. You can also use this website to find providers. So if you are looking for a hospital, a nursing home, a home care agency, you can search this this website for those kinds of things as well. Anything that Medicare licenses, you should be able to find. They've got some videos, a little bit of explanation of how the $2,000 cap works. So let's click on the Find Drug Plans. And I will just use my zip code. So this is the site that you use if, in fact, you already have an existing account. We're just going to, at this point, as I said, use just a generic account, or I mean a generic search, so it won't be individualized to any one person. And I'll just use, so we're going to look for 2025, and I'll just use my zip code. For purposes of this presentation, we're going to do the Medicare drug plans only. And then we're going to look then specifically at that. So the first question then is, do you get help with your Medicare health or drug costs? And if you get help with one of these programs, then you need to check those. For the moment, I'm going to assume that nobody's on Medicare and Medicaid, that nobody's on supplemental security income, the Medicare savings program, or extra help. So I'm going to check no, I don't get help from any of those programs. The next question says, do you want to see your drug costs when you compare plans? And the answer is yes. So the next thing it's going to ask us to do is to enter the drugs that we might have or that we are currently taking. I'm just going to randomly enter some drugs. And there's no real rhyme or reason to these. This is just some of the drugs that I know that a lot of older adults use. This albuterol is a inhaler. I'm going to add another drug, which is atorvastatin, which is a cholesterol drug. And again, I'm just going to randomly use what they have. But if you take a 10 milligram tablet versus a 40 milligram tablet, and you take 2 a day as opposed to 1 a day, or you take half a pill every day, then you can adjust these. Like to every 2 months, you can adjust this to 15 if you take these every day or only a half a pill a day. So we're just going to accept the default for the purposes of this demonstration. We're going to add another drug, which is levothyroxine. which is the drug that many people take for thyroid. And again, we're just going to accept the default. We're going to add meloxicam, which is a pain medication when people have like a lot of pain from arthritis or something. So we'll add that one. And then we're going to add another drug called Wellbutrin. And this is a mental health drug. So those are the ones we're going to add. It asks us here now, do we want to do the generic or do we want to do the brand name? So if we want to do the generic, we hit add generic. If we want to keep the brand, we can get the brand name. So I'm going to go ahead for purposes of this demonstration for the first time around here. I'm going to keep the brand name, okay? And I'm going to add it to my drug list. So now I've got albuterol, atorvastatin, levothyroxine, meloxicam, and Wellbutrin. And if I had more drugs, I just keep adding them. I want to do a quick check over here to make sure that I haven't made any errors based on my drug profile. So now we're done adding our drugs. So now the next thing it asks us to do is we can choose up to 5 pharmacies. Pharmacies this year are extremely important, and they are important because there's a lot of variation in what pharmacies are charging. Additionally, there is a lot of pharmacies that are not participating. So a while ago, when I was kind of prepping for this class, I put in a Fort Collins address with the same basic group of drugs and found that on some companies, King Soopers or Kroger is not participating in Fort Collins. Now, I would want to check that before I made any specific recommendations to people, just to make sure there wasn't an error. So 80220 is where I am. I can add pharmacy names if I want to. If I have a specific pharmacy that I'm specifically, that I'm brand loyal to, I always go to them. I can change this distance from 1 mile to 5 miles to 10 to 25, depending on where I live. There are a number of pharmacies within a mile of my house, so I'm just going to leave that one. Always the first option that it gives me is, do I want mail order? For people who are using very stable drugs and for whom sometimes travel or transportation is an issue, mail order might make the most sense. So let's check it. The other thing that I have observed this year as I have worked with this is that sometimes mail order is not actually the cheapest. That sometimes mail order is more expensive, depending again on the drugs that I've randomly put in or the work that I have done for other clients. So the next thing is that it asked me if I want to do which pharmacies. And an interesting thing on this search is that there are 2 Safeways, the exact same number of the store, the exact same address. And if you put, and I'll show you just to put them both in, if you put one of them in, it says it's out of network and they don't participate, and the other one says it is. So I'm going to add King Soopers and I'm going to add Walgreens. The rest of these, from my perspective, are really specialized, if you will, pharmacies, so I'm not going to do that. Now it gives me down here at the bottom, then the names of the pharmacies that I have put in, and I go over here and I click done. So now I'm reviewing the 25 plans, tells me about Medicare Advantage. I'm not interested at the moment. I'm in Denver, and I'm doing prescription drug plans. So this first filter now is going to be on insurance companies or carriers, and then I can search on star ratings, and I can view all of the filters depending on kind of what I want. So for starters, I'm having it sort the lowest drug pricing plus the premium, okay? Given these parameters, 10 of the 14 drug plans that are available in my zip code are going to be showing here. So the first one that comes up is WellCare Value Script. Now it's important when you're signing up that you pay attention to what this ID number is, because as you are signing up, WellCare may have more than one plan. And if this is the one I want, I need to make sure that I sign up for that one. So this is telling me that I have a 0 monthly premium, that my out-of-pocket costs are going to be $5,404 if I choose this one at the retail pharmacy. At the mail order, going to be about $5,400 as well, and that I have to pay a Part D deductible. Also tells me over here that 3 of the 4 pharmacies are in network. And so I'm going to come back to this. Also tells me that I can look at the drugs and their costs in more detail. But before we do that, let's scroll down here and see if any of these other plans. So there's a Cigna plan with an $11 premium. Again, approximately $54 out of pocket, whether I use retail or mail order, and I have to pay the Part B deductible. Here, only 2 of my pharmacies are in network. So let's look at Cigna. Same thing, 2 of the pharmacies, $20, $54 out of pocket. Humana, a $15 charge, $5,600, almost $5,700 with a deductible. 3 of the pharmacies are in network. Here's another one of those WellCares. While they increased the premium, and they also increased my out-of-pocket costs. SilverScript, Humana Value. As you can see, I'm going down the list. My premium plus my out-of-pocket costs are continuing to increase. Okay. Now, if there's more, you can push this over to the second page, and there's a couple more plans here, but they're all continuing to get more and more expensive. Okay. So for me, this doesn't look very promising. Okay. I don't have $5,400 that I can pay out of pocket. But let's take a look at this and look at it from this perspective, and then we can look at it again. So if I look at these pharmacies, so here is the drug coverage I put in, and I kept, basically 1 a day, and I kept the generics except for the Wellbutrin, I did the brand. So now I look at these pharmacies, and King Soopers, it says, is in network. This Safeway, which is the same one, says out of network. This one says preferred and in network. And then Walgreens is in network and mail order is in network. Okay. So now I look at the yearly drug costs by pharmacy. And if I am looking at King Soopers, what I see is the albuterol is going to cost me $737 for the year. Walgreens is pretty much the same price, Safeway and mail order. My atorvastatin, if I went to this, I just want to show you this because we've confirmed that this Safeway is the same as this Safeway. So there's no cost for these 3 drugs on any of these. When I get to this Wellbutrin, if you remember, I checked that I wanted the generic, or I mean the name brand. So this tells me that Wellbutrin is not on the formulary, nor is albuterol. So for these 2 drugs, if I need to have them, I'm going to have to pay 100% of the charge. And in addition to that, none of those costs will count toward my deductible, nor will they count toward the $2,000 out-of-pocket cost. So this just adds in the monthly premium, and I'm looking at around $54. It also says here that I will not meet my deductible, even though my out-of-pocket costs up here are going to be pretty high because these drugs are not on the formulary. I'm not going to meet my deductible. This gives me then the monthly cost if I go to one of these pharmacies. Drug prices may vary depending on where we are. So then we want to always click on these boxes that say view more details. So this box tells us what drug tier we're on. And what we find is that, again, if it's a tier 1, 2, 3, 4, or 5, and then we take a look at our drugs, and here's where we find the albuterol is not covered. The atorvastatin is a tier 1, the levothyroxine is a tier 1, meloxicam is a tier 1, and Wellbutrin is not covered. So none of these drugs require what we call prior authorization, meaning that when the doctor writes a script, we don't have to get the company to approve it. 2 of our drugs, even though they're generic and they're tier 1, have what they call quantity limits. And that means that if you take more than 1 pill a day, that's going to require a special authorization, or you will have to pay for the 2nd pill every day. On the meloxicam, similarly, they'll pay for 30, but if you need more than that, then you'll have to pay for those. None of the drugs are on step therapy, meaning you don't have to try a different drug before you can get the company to pay for them. And in this instance, what they basically said is 2 of your drugs aren't on our formulary. We're not going to make you back up and take a cheaper or different drug, mostly because we're just not going to cover them. So the next thing we see here is the star ratings. And all of the drugs plans can get up to 5 stars. So they grade them on a number of different things. So this one gets 3.5. Most of the drug companies don't get very good drug star ratings. So on their customer service, they get a 4. They have TTY services, so they get a 4. They don't get a lot of complaints. they are, people leave their plan, kind of half do, half don't. And they've, not really shown much in the way of improvements. The members rate their plans. Again, they mostly just give them middle of the road ratings. And then Medicare takes a look at things like drug safety and accuracy of pricing. And again, they're mostly in the 3 category. And then the summary gets them a 3.5. So we can collapse all of that. So this is kind of what and how you would read this. Now what I'm going to do is I am going to go back up here, and this was just kind of the overview, okay, for WellCare, I think it was. So now I'm going to change drugs. And I'm going to go in here and I'm going to edit this drug, and I'm going to go, I guess I may have to go all the way back. Hitting that back button up there is not what you want to do. So let's see here. Let's just add another drug that'll be safer. So we'll add this Wellbutrin again. So we're going to add the drug, and it's going to ask us if we want the generic. So I'm going to go ahead and I'm going to add that to my drug list. Okay. And then I've decided that this Wellbutrin is just too expensive. So I'm going to take it off. So now I have bupropion, or however you pronounce that, as my mental health drug. Okay. So now I'm done adding drugs. So now I'm in the WellCare, and I'm back now looking at what it's going to cost me. So now my monthly premium is going to be $0. My retail pharmacy cost is going to be about $800, as is my mail order cost. Okay. So I have 0 premium, still have to make the deductible, and this all looks the same. Okay. Except now I've got a generic here as opposed to the name brand. Okay. Now I'm still in network with all of my pharmacies. So now take a look at what happens with my drug costs. So this drops from $5,000 or $6,000 a month to Walgreens and Safeway and mail order to about, a year, to about $800. Okay. So they really are encouraging you, if you will, to take the generics. Now, again, because I selected the drug up here with a 0 premium, all I'm paying is the retail cost here. Okay. And the one last thing I want to make sure and check before I decide if I'm going to enroll in this one is, are there any more quantity limits? And yes, again, this is a tier 2 drug. Okay. But they still have it as a 0 copay. And again, if I take more than one a day, I have to pay full price for the drug. Everything else in this scenario is going to stay the same. So my biggest problem here is that I have this albuterol, and it is not on the formulary. Now, I don't know enough about inhalers to know whether or not there's another type that I could take and get the same results, or whether I will be required to basically pay the $700 that is, at any of these pharmacies for the cost of that albuterol. And that's an annual cost. So the monthly comes up to about $66. Okay. So now let's take a look at the WellCare. Back one more. So we looked at WellCare. Now let's take a look at Cigna, just so you can get kind of an idea of how this works. So again, we're now looking at the same drugs, but with Cigna. So they're charging an $11 a month premium. The retail pharmacies are a little bit higher, and they're charging the deductible. Only 2 of the pharmacies are in the network, and then we could take a look at their drugs. So what if we choose that? Here it says King Soopers is out of network if I buy the Cigna one. We didn't change the Safeway one, so this one's still out of network, but we're still in network here. Okay. Now, what is causing us all this extraordinary charge or cost? So if we go to King Soopers, we're paying full price basically for everything. If we go to this Safeway or Walgreens, then we are paying a lower price. But what you can see here is under Cigna, the albuterol is cheaper. Okay. Atorvastatin is more expensive. The Wellbutrin is more expensive. The levothyroxine is more expensive. The meloxicam is more expensive as well. So what that tells me is that albuterol is on their formulary, but they're not giving you the same pricing for all the rest of your drugs. So if we look at this, again, here's the estimated total. So we have $11 a month premium plus the drugs. So we're looking at, if we go to Walgreens, $825, Safeway, $769, and mail order, $758. Obviously, we never want to go to King Soopers. And like I say, I don't know what happens and why this is in there for Safeway, but it is. So here then we see that our monthly out-of-pocket costs for the 6 months or so are $100 a month if we're at Walgreens, but only $66 if we're at Safeway, meaning we're not getting as quick to the deductible as we might be if we were using the Walgreens. So Walgreens seems to be a lower monthly out-of-pocket cost, if you will, for this particular plan. So again, because they're charging us for each one of these, they have moved, if you buy this plan, some of these are catastrophic or 49%. We don't really know what, well, yes, we do here. So the albuterol is a tier 3, so we're paying 17%. The atorvastatin is a 1, so we're not paying anything. The Wellbutrin generic is a tier 3, so we're paying 17%. The levothyroxine, we're supposed to pay $2 copay, and the meloxicam is 1, and that's supposed to be a 0 copay. Again, we can look at their star ratings. we go into this knowing that they only have a 2.5 instead of a 3.5. So they probably get a lot of complaints and don't answer their phone, and members don't rate them real high. So, they're kind of just out there. So as we're doing our due diligence, if you will, that's how we kind of have to play with this plan finder to figure out what it is that we want to do. So if we want to do a side-by-side comparison, we can add it to compare. And we can just do the first 3 of these. And it tells us then which ones we put down here. So we're going to hit compare. And sometimes this is useful as well. So here we see that the Cigna has the monthly premium. The WellCare does not. And then this Cigna has a monthly premium as well. So this tells us the premiums. This tells us the deductible. And then this one says prescription drug covered. So all of our drugs are covered here. And the WellCare one is not. And in the Cigna, again, they're all covered. But then what we have to do is also then take into account what are the charges at the pharmacies, and is the pharmacy in network? Are we, or do we have the capability to change pharmacies? So for example, last week when I was in Montrose, the only participating pharmacy in the WellCare program was Walgreens. And some of you may have heard that Walgreens is talking about closing some of their retail stores around the country. And one gentleman was quite concerned about what if Walgreens closes here in Montrose, what will I have to do and where do I have to go get my drugs to be in network? Now, the answer that would come out of Medicare is that they would have, that WellCare or Cigna would have to contract with a different provider, a different pharmacy in Montrose. But whether they would or would not, and what that would look like and who it would be, I don't know. So in this instance, it looks like our WellCare value script, PDP, is probably going to be our best bet or our best plan if we buy at King Soopers, Walgreens, Safeway, or we do mail order. So, and then if you like this WellCare one, you can hit enroll, and you can enroll yourself, or you can work with an agent, whatever works best for you. So here we see that plan number, again, our plan ID, and we want to make sure that we're enrolling in the plan we want. You will need your Medicare number and the dates when you were effectively enrolled in Part A and Part B. And then if you have any other health insurance coverage, like if you work for the federal government, or if you're getting drug coverage, say through the state of Colorado. And then if you are joining any type of, if you're going to long-term care or whatever. Now, this is about as far as I'm going to be able to take you. There are 7 steps here, and I don't have a dummy Medicare number that I can put in here. So our plan number, we're only enrolling for prescription drug coverage. We have to put a Medicare number in here, and I don't want to reveal one because, this is in a public situation. And then this just gives you some warnings about if you have an employer group plan or whatever, making absolutely sure that you know that you're enrolling in a drug plan, etc. This is their privacy statement. And then if you check that and put a Medicare number in, then you can click next. But this is as far as I'm going to be able to take you on that. So now I want to show you, I want to go all the way back here, and I may have to re-enter all of this. Okay, so now if you're low income, meaning your annual income is, your monthly income is less than about $18,000 a month, and you have less than about $18,000 or $19,000 in the bank, you might qualify for this extra help. So let's switch from I get extra help and continue. It kept our drug list, so that's really nice. So we're done adding drugs. We'll use my zip code again, and then we'll find pharmacies. So Safeway and their 2 pharmacies, King Soopers, Walgreens, and then we have all these kind of specialty pharmacies. So let's just use the the Safeway, the King Soopers, and the Walgreens again. So I've got all 5 of my pharmacies down here at the bottom. So now we see a difference. So we're still in Denver, we're still in insurance, in the prescription drug plan, and we've got it filtered lower cost, lowest drug plus the premium, okay? So this time, Cigna comes up with a 0 monthly premium. $166 if we get retail. If we do mail order, it's $78, and the drug deductible is 0. Now, the reason we checked the extra help is because that is the federal program that helps to pay for premiums, deductibles, and copays, excuse me, for participating drug plans. Not every drug plan participates. So we see this Cigna one does. I'm going to go down. This Cigna one does. SilverScript does. But as you can see, when I left this 0 one, although my premium is, I still have to pay some premium, but I don't have to pay a deductible. But my out-of-pocket costs go up. If I look at SilverScript, again, I have to pay part of the premium myself. I have to pay some of the out-of-pocket costs and no deductible. This WellCare that we looked at a while ago, with this plan number, the premium is still 0. It's reduced the deductible to 0, but now I have almost $800 in prescription drug costs. So it may not be worth my time to enroll in this 0 one because now it's more out of pocket. Plus, I've got 3 of my 4 pharmacies over here. If I go back up, and this initial Cigna one is the least expensive, but I'm now limited to 2 pharmacies. So the only pharmacies that I can use are Walgreens or Safeways. And it looks to me like Cigna did not contract this year with King Soopers for whatever reason. So The albuterol for the first month, I would have to pay, even on this limited program, I would have to pay $58 a year for that, $11 for the atorvastatin, $58 for the mental health drug, $42 for levothyroxine, and $13 for meloxicam. And then they basically pretty much average out my monthly costs. So that's how I can tell whether or not, or what the charges are if I qualify for the low income or for the extra help. And what we see here is if I do the SilverScript, which takes my out-of-pocket from $166 if I buy at retail, and only go to those 2 pharmacies. I want the option to go to 3 pharmacies, then I have to pay more. Okay. That is basically the summary of how to use this plan finder to sign up for a standalone Medicare prescription drug plan. Does anyone have any questions? Okay. If anybody needs help or has concerns about this, why we can certainly oh yeah, I probably did not mean $18,000 a month. So Pamela says not covered means it's not on the formulary. If a drug is not on the formulary, then it can't be considered for prior authorization. That is absolutely correct. Other questions? Okay, well, thank you all for attending. And please call our office at 303-333-3482 if you would like one of our counselors to help you with this enrollment process. Hopefully you'll be able to make those decisions by yourself, but if you get stuck, you're certainly welcome to give us a call. And thank you again for attending.